Start by telling me why M1033 is so important.
The biggest reason this is important because it's going to affect your PDGM and your STAR ratings.
It also contributes to the patient's overall functional impairment level under PDGM, which in turn affects reimbursement.
This item can give you up to 11 points when answering items 1 through 7.
It's significant in the PDGM model, and it contributes to the patient's overall functional impairment level. So it ultimately impacts reimbursement, right? So if you're coming from this as a leader in home health and you're thinking about how you can create a clear picture of your patient, we do want to be as accurate as possible and maximize what we are owed for the patient that we are giving care to. Let's start with history of falls. What are some things you're seeing here, some questions you've had with history of falls?
One of the things I'm seeing is that some of the clinicians are not including sprains, skin tears, lacerations here. I believe they think that only a fracture constitutes as an injury, and that's just not true. It's any fall with any injury. And those falls also include intercepted falls. If that patient is caught and they fall, that is still included.
If the husband tells you that the patient almost fell this morning, you would count that, right, Tina?
That's right. Yeah. Yeah, it doesn't.
That's
Now, of
what I would
course, if
do.
he pushed her, that doesn't count.
So, how about unintentional weight loss? We're talking about unintentional weight loss.
Yes, it has to be unintentional. You can't be trying to lose weight. So it's a weight loss of 10 pounds or more in the last 12 months. It has to be unintentional, like we said. And you also have to be sure and add the patient's BMI. You don't want to forget that Z68 code when you're adding this to the patient's chart.
Yeah, so if the patient went on keto diet and they lost 25 pounds, that doesn't apply here.
Let's talk about multiple hospitalizations.
Remember on this one that it's within the past 6 months. So if you had two hospitalizations and they're 12 months apart, that's not going to apply here. And the biggest thing to remember, this is not for OB status. This patient has to be admitted 24 hours or longer to an inpatient acute bed, and it has to be for reasons other than diagnostic testing.
Okay, as opposed to multiple emergency department visits, correct, which is different.
Yes, that's different. That means the patient is simply visiting the emergency room for emergent care. It doesn't include urgent care centers, walk-in clinics, or an emergency phone call to your doctor to see if they can squeeze you in. This exclusively includes only the hospital emergency department. And if they're transferred from one emergency department to the other because they need a higher level of care, that still counts as two separate visits.
All right, moving on.
Okay.
Okay, so let's talk about decline in mental, emotional, or behavioral status in the last 3 months.
So remember the time point on this is just within the last 3 months. And also remember that this can be reported by the patient, the family caregiver, or the physician. And it doesn't matter the cause. It doesn't matter if it's dementia, depression, anxiety. Just remember that it can be temporary or permanent, and a physician consultation may or may not have occurred.
Reported or observed history or difficulty complying with any medical instructions. So, for example, medications, diet, exercise in the past 3 months.
Yes. So if the patient has a provider that is prescribing their diet, such as a diabetic diet, or they have an exercise plan and they're prescribed a bunch of medications, it's really important that the patient is complying with all of those. If they're not complying with their diet every day, if they're not taking their medications correctly, if they're simply refusing to do their exercise plan, or they're cognitively impaired where they don't understand the exercise plan, this is where number 6 becomes applicable, and you should certainly check this item. Also remember, if you choose this item, you cannot code noncompliance, the Z91 code, unless the physician has stated that the patient is noncompliant. However, you can check number 6 without any MD documentation.
Okay. Currently taking 5 or more medications.
Yeah, on this one, remember that it's prescribed and over-the-counter medications, which includes vitamins, TPN. It can include injectables. So it's any route. It doesn't matter the route. A lot of clinicians here are only including PO meds or medications by mouth, and that simply doesn't capture this in its entirety.
And I think another good point to remember, Tina, is you have to count how many medications the patient's actually prescribed. If the doctor prescribes 10 medications and the patient's only taking 4 because they don't think they need the other 6, you still want to check that they're on 10 medications because that's what the doctor is prescribing.
Yeah, I think that's another place where they're answering this one incorrectly, because if they go to the medication profile and they only see 4 medications on there, they're not taking into consideration what all the doctor has ordered, and the patient chose not to take those.
Next one is currently reports exhaustion.
Yeah, this is a really important one. It doesn't get you any functional points. However, it's really important to remember that physical exhaustion as well as mental exhaustion can really impact a patient's willingness to participate in the home visit, in physical therapy, occupational therapy, and really it just affects their emotional status, how they're feeling. They're tired, they're emotionally tired, they're drained. So that can really affect them. And I think a lot of people forget about the emotional or mental aspect of it, and they really just think about the physical aspect. And we really want to be able to capture both if we can.
Yeah, and we need to remind them that the doctor doesn't have to say they're exhausted.
Right.
This
That can certainly be self-reported. Yes.
Yes, exactly.
What about other risks not listed in 1 through 8?
So on this one, it also does not give you any functional points, but on this one, you're going to select 9 if there's indications where the patient may be readmitted to the hospital. Things like open wounds, maybe they came home on IV antibiotics for sepsis, they have multiple comorbidities, slower movements due to certain conditions they have going on, say they're in and out of the hospital for CHF exacerbation. So you're going to capture that in this item. Again, it doesn't give you any points, but it is appropriate to select 9 to capture these types of situations.
Anything else you guys want to add about 1033 or what you're seeing?
I just wanted to add that it's really important for agencies to educate their field staff on this item, because really a clinician with strong patient assessment skills and really solid clinical judgment is going to help you accurately capture each one of these items. And you know how important they are because of the 11 functional points that they give. So it's an important item to review frequently.
Yeah, and I think that on this one, it just takes a little bit. Sometimes you have to dig in that documentation a little bit more to find some of these things. So as you're going through that, I think you should always be thinking about 1033 when you're looking at how many hospitalizations they had, like how sick they are, those types of things. So with that being said, you're going to next to never select response 10, because if you select that, then we're going to think like, why is this patient even in home health? Are they
Maybe they don't
homebound?
need home care.
Right. So
Right.
that's something to consider. If you feel like you need to select response 10, you may want to see if this patient even needs home health.
Thank you for joining us for this episode of Coding Corner, brought to you by HealthRev Partners. Grow your agency and expand your mission with a high-power revenue cycle management partner, powered by Velocity, the most advanced coding and billing software in the market for transparency, analytics, and clinical intelligence.